Hi, and welcome to Healing Through Science and Soul. I'm Dr. B, and one of the most common diagnoses that we see in the clinic through the pelvic area is either pelvic floor dysfunction or a diastasis recti. And so I just wanted to take a moment and just share with you guys how our non-traditional approach works, because it is very different than the traditional pelvic floor physical therapy route. I am a pelvic floor physical therapist. I'm a certified pelvic rehab practitioner. However, I don't do a lot of the traditional therapeutic intervention, and there's a lot of reason for that. One of the biggest things is in the last 7 years of my practice, I have seen that the lines of tension are actually outside of the pelvis, and the pelvis is actually the secondary or tertiary issue to what's going on, let's say above the system or even below. It could be in the leg, it could be an ankle or a knee problem that's actually creating the pelvic floor dysfunction. So it's really important from where I stand to ensure that we are looking at the entire patient and not just going based off the diagnosis that we're receiving or the symptoms that we're seeing, right? If somebody comes in with urinary incontinence or pain with intercourse, we want to make sure that we're not just tunnel vision, assuming that it's pelvic floor muscle related, but that we really are looking outside the box and assessing the whole body and making sure that we know where those lines of tension are coming from, and then releasing the appropriate ones to then be able to go to the pelvic floor area and the pelvic cavity and be able to restore that. But if we don't remove those lines of tensions or shift the body in the way that it needs, we're just beating a brick wall, basically. You could do 100 million Kegels a day, and it's not gonna, if you're doing them right, because there is a high percentage of patients that just simply don't know. You don't know unless you know. So unless you've really been taught how to utilize those muscles, it's very difficult to just know it. So it's important that you have somebody walk through that with you. But those often aren't the answer, but they are a support to, once those lines of tension have changed, to really being able to support your system. Okay. So let's say the patient here came in, well, she did originally come in with a diastasis. So lots of things to consider there, but we are looking at, a separation through the abdominal tissue. Maybe it's from weight gain, weight loss. Maybe it's from pregnancy. Maybe it's from an injury or surgery that can happen. It's going to change the pressure systems. Okay, so one of the things that we most commonly see with diastasis is that, yes, it's happened, but how do we help it function better? How do we help your system restore? And it really, again, is lines of tension. So if she comes in and she's got a 4-finger diastasis, I want to know why. Yeah, you've had so many kids, sure, that's going to be a risk for that to happen, but I want to know why it's still there. Why has it not reapproximated? Maybe she's done a bunch of abdominal things to try and approximate that tissue and it's just simply not doing it. Why, right? So at the end of the day, we're going to come through and we're going to assess what are the lines of tension through here. So if we look at my coat, okay, and my coat is, we want the sheath to come together, okay? Well, if I have something underneath, let's say it's my liver, and my liver isn't positioned where it needs to be, and it's pulling on that, okay? So now I'm sitting there and I'm trying to do these crunches and I'm trying to do all of these things, but underneath I have a vital structure that's locked up here. I'm not going to be able to approximate that tissue. So as a visceral, neural, lymphatic, vascular, pelvic health, and energy specialist, my job is to figure out what's happening in your system, that when we release that thing, so let's say it's liver in this situation, that now we're able to retrain and reapproximate those tissues. Okay. And that would be the same for the pelvic floor, is can you engage them? And if you cannot engage that bowl of muscles, why? Is it that the pressure systems are off? Did you have a respiratory issue or illness that now has created some pressures throughout the system that have changed? Okay, so that's really what we're looking for, is the why. At the end of the day, why is this happening? And that's what we want to address. Okay, so for instance, let's say her diastasis were led to the liver. So just like I showed you here. So then I'm going to come in and I'm going to do visceral manipulation. We want to look at how is that organ functioning, because that's how the organ communicates with the brain, as well as is it moving? Okay, because if it's not and it's pulling, that separation is going to stay there. And we're just going to keep doing all of these things to try and get it better, and it's not. Okay, so we have to remove or transmute or encourage proper function of the thing that is holding the system back from doing what it's supposed to do. So do a treatment of the liver and releasing that line of tension. So just like I showed you, you can see she takes a big breath there. So releasing that line of tension. And then, okay, anything further more specific? No. So now I'm going to come in and reassess that. Okay, if that was the only thing pulling, if that liver was the only thing holding that back, bingo, we should be able to say, okay, look, we can actually close that in. She can engage. That feels good. That closes in. Now we want to retrain it. If there's more than one line of tension, well, then we move on to the next priority within her system to help, again, release this so that it can do what it's supposed to do. You're good. Okay. If you have any, we got her going, didn't we? Through the diaphragms and all the things. You can sit up if you need to. So if you would like to work with us, we would truly be honored. Healing Through Science and Soul, and just go to our website and we're happy to have you schedule with us. Thank you.